Hi, I'm Rose Hayden with Hunt Regional Healthcare, and I'm with Erica Parks, the Outreach and Wellness Coordinator for Hunt Regional Lab Solutions. Erica, thank you for joining me.
Thank you for having me. It's a pleasure to be here.
Yes. Now, what is Lab Solutions?
Lab Solutions is the solution to your laboratory needs.
Okay, what does that mean?
That means that we are more than just phlebotomy. We provide services for outreach and wellness. We are an extension of the main lab here at Hunt Regional. We go out into the community and we provide phlebotomy services for the nursing homes. We go to, we have 14 service centers in 5 counties, including Hunt County. We are in Hunt County, Fannin County, Rockwall County, as well as Rains County.
Wow.
We outreach with engaged employers within the community. We have those employers come in for services to the hospital so that they can have health fairs done, or we do volunteer opportunities where we go out and provide services like blood pressure and body fat analysis.
Sure. So you might draw blood for a lab test or
Correct.
urinalysis or some sort of stool test, something that you're going to then take back to the lab and process?
That is correct.
Okay.
So once we collect all of those specimens, we do take them back to our main lab, or either they go out to a reference lab where they are sent for processing.
Okay. So sometimes you're at a location, sometimes people are coming to you, and you're located, you said, at over 14 different locations.
That is correct.
Okay.
So we are located primarily in physician associated with Hunt Regional.
Okay.
So everywhere that you can go to see your primary care, we will have a site there. for
Wonderful.
blood draw.
Very convenient.
Very convenient, yes.
Okay, so what are some of the lab tests that physicians often order?
Primarily, you're going to see someone order a CBC, which is going to be your complete blood count. Which is going to give an overall value of your total body health. They're going to get a CMP, which is a comprehensive metabolic panel. That's going to be more of your electrolytes. That's going to determine the function of your liver and your kidney. They will do lipid tests, which help to determine your
Cholesterol, right? Ah, that's
Yes.
a big one. Nobody likes
Very
that
important.
answer.
Some of the other ones for males, they like to do a PSA, which is going to be the prostate-specific antigen test, which is going to determine your prostate cancer in males. And you do have to be over 40 to 45 to do that for most insurances.
There's usually recommendations
There
from
are.
either the federal government or different specialty groups like American Cancer Society or
Yes.
so on, right?
Yes, absolutely.
Okay, and so, some of these tests are recommended more often than others. So sometimes you get them once a year, sometimes you get them more than that. Give me
Yes.
some examples.
So we leave that determination up to the physicians. We're not physicians, so we just follow physician orders. If a physician is trying to monitor therapeutic drugs, they may get tested weekly or daily. If the patient is there for annual wellness labs, then of course it's just going to be once a year. If it's something like a PSA screening, that's something that could be once a year or it could be once every 5 years, depending on the regulation at the time.
Okay, and so most wellness screenings are covered
Yes.
by insurance. Are there others that are covered by insurance?
Most wellness screenings are. There are a lot of labs covered by insurance. Each insurance, of course, is individually monitored and regulated by different providers or different insurance providers. So we do recommend that you check with your insurance to see what kind of coverage that you have. But if you do come in and you're looking at a test, most of our service centers, they do provide eligibility coverage for you. So we can check it before you decide if you want the test.
Oh, that's great. And let's say I didn't have insurance, but I needed to get a test or two. Is there another way to pay for it?
There is. So we offer direct-to-consumer testing, which is MD Save, and so that's like medicaldoctorsave.com. And you can go there, you can purchase a test. Most of the tests on there do not require a physician's order, so you have that option. Some of them do. So you can purchase those before you come in for testing, or you can purchase them at site, and our phlebotomist, our techs can help you go through the
Walk you
process.
through that? Oh, good. Very convenient. Give you options, right?
Absolutely.
Oh, wonderful. Okay. Now, one screening that we hear about often is A1C. This differs from blood glucose level. There are quite a few people in our community that have diabetes or are pre-diabetic.
Correct.
Can you tell us the difference between these two tests?
Right, so both of these tests are very important. They are the #1 test for determining your diabetes or if you're pre-diabetic. The glucose test itself is something that you can typically do at home, like if you have a finger stick or a glucose monitor. If you do come in, it's just going to be hopefully a fasting glucose level so that it can determine your current sugar value or glucose value. For the A1C, that's more of a comprehensive or long-term test, and it's going to be a percentage value. So that one is going to determine your glucose over a number of months. So between 2 and 3 months is how they'll determine that glucose value, and that's more of a comprehensive determination. Like in case you had a donut for breakfast, it's not going to throw off your A1C value.
Kind of a longer look back, right?
Correct. Yes,
okay. And then we mentioned finger stick, but most of the time you're going to draw blood in a vial.
Absolutely.
And there's actually very little blood in there. It always looks like more, but often it's just a little bit when you explain that to me. And then sometimes you have to draw more than one. So what's the difference between drawing blood this way, right, through the vein,
yes,
and then a finger stick?
So we prefer a venous because most of the tests that we perform, each one has a different, I guess, quality expectation or a value that it needs to be ran or analyzed in the lab once we take it. So like the CMP that we mentioned, the Comprehensive Metabolic Panel, it has up to 14 tests in it, and each of those tests requires like a minimum of 0.5 mils. So if we just do a finger stick, we're gonna keep finger sticking you 14 times, and usually that's not preferred by the patient. So we definitely try to knock them all out in the beginning.
Okay, very good. And then what last bit of advice would you have for our viewers?
I would just say that we are more than phlebotomy. We definitely have the same values in mind with Hunt Regional. We try to stay on the same page. We value the community. We want to go out and we want to serve and do it in the most cost-effective way for the patient. And we are, if you're looking for labs, we are definitely your solution.
Wonderful. And I know we were talking earlier and you mentioned that even more than 70% of the medical decisions that physicians make for your treatment and your care have to do with those lab values.
That is true.
And it's important. I think people need to understand how important those values are, not to let that go for years and years and years, and actually looking at a consistent test over many years can give that physician, that provider, more of an understanding of what's specific to you, what's normal for you, and what the treatment plan should be.
That is absolutely true.
Wonderful. Well, I have learned a lot. I appreciate your time.
Well, thank you so much for having me.
Thank you.
This video has been brought to you by Juice 34. Juice is your community-owned provider for electric, internet, cable TV, and true local programming.